It's a beautiful day in the neighborhood, a beautiful day to ask a gay doc with Dr. Renzo Corzano of Desert Oasis Healthcare. Hey, Doc Renz, what's going on?
Oh, just hanging out.
And sweltering like the rest of
Exactly.
America.
Oh my God.
Have you had a lot of patients come to you with, heat-related distress?
No, they call us and then we basically tell them to, if it's really bad, we tell them to go to the immediate care to get hydrated for
Right,
sure. But
right, like an
yeah,
IV.
pretty much.
But yeah, people living in the desert, we know what to do. Close the blinds, hunker down, and we just stay inside with
And
the AC
hibernate.
and hibernate. It's kind of like winter growing up in the Northeast,
Yes.
except you can go outside at night. So here's a thing to be frantic about. We have a new fungus, a fungal infection that is being spread among the MSM community. Is this true?
Yes. So it's called trichophyton. It's actually it's ringworm. Okay. That's basically what it is. And it's been around for a while, usually, in people, cats, dogs, but there is a subtype that can be sexually transmitted. So it's usually treated with like routine antifungals, which can be oral or topical.
Mm-hmm.
But there are some parts of the world that actually have some resistance to these antifungal agents. So I found this paper actually from 2023 where they documented these outbreaks in basically MSM. They saw 13 cases, and it was from March 2021 to September 2022. And that data basically suggested that this trichophyton is like basically circulating in this population. And that's when they first kind of linked it to a possible sexually transmitted infection.
You could also get it from cuddling.
Exactly. Yes, it has to be close contact, right? So for
Yeah.
sure. And two of those people were actually co-infected with monkeypox, which we're going to talk about a little later.
Okay, so when we say MSM, the community we're talking about is men having sex with men.
Exactly.
And now, if this goes untreated, are there any dire long-term effects?
No. So it's definitely not fatal, but this specific type of trichophyton fungus, it's actually very scarring. So if you don't treat it in time, it can actually cause abscesses and it can actually lead to permanent scarring. And it can take a couple months to clear up. And I think one of the reasons why it can take some time to clear up is because people are getting misdiagnosed because it's so new, right? I mean, we don't really see that many fungal infections compared to like just regular rashes.
So when you're looking at your beautiful body in your bathing suit and you're checking your look in the mirror, what would
what are you looking for?
yeah, what are you looking for?
So basically, it may look like jock itch. So if you see anything around your jock area or ringworm, and ringworm is basically like a ring-shaped red rash across the skin. It can be one single patch or a couple patches of like dry, scaly skin. But with this fungus in particularly, it can also cause like a rash that can look more like eczema. So people are kind of treating it with like steroids for the eczema, and then it tends to kind of get worse.
Oh, okay.
So yeah, so that's something to look for in with this fungus here. And there was a case which basically got everybody's attention, and that stuff was just published in June. And it basically talks about this gay man in his 30s in New York City. And he presents it with like scaly red patches around his groin, his buttock, his leg and arms. He had just recently traveled to England, Greece, California, multiple sex partners. And he had to be treated with some heavy duty antifungals for it to actually clear up.
Wow, he was popular.
Yeah, but
but it
we don't
cleared
judge.
up. It cleared up. Yeah, no, there's no judgment, but you do want to be discerning when it comes to your own health, and that's why
Absolutely.
if you have a question, you can always send it to LGBTQ health at mydohc.com to Dr. Renzo Corzano. Now we move on to monkeypox, which is kind of rearing its ugly head again.
Yeah. One more thing about the trichophyton, though, there is no like pre-exposure medicine for this. Okay, so like definitely be careful, and if you notice any rashes, then you should go talk to your doctor about this.
Okay.
All right. So monkeypox. Little background on monkeypox. Okay, like it's been endemic in Africa for a very long time. It was first identified in the MSM population in the UK in 2022, and then it came over here. And then basically in 2022, that's when we had the most cases of it. It basically peaked at about 3,200 cases per week in August of 2022. Okay. And that's when there was this huge like push and like, we mobilized to vaccinate people, like the 2 doses and all that stuff. And then basically in 2023, it was a very low monkeypox year. And I think what happened is, it was basically out of sight, out of mind, right? People, the ones that didn't get vaccinated probably didn't get vaccinated afterwards, or, what have you. And basically what's been happening lately is that if you compare 2023 to 2024 around the same time right now, in 2024 so far this year through March, we've seen about 573 cases, and compared to the same time last year there were less than 300.
Mm.
So it's almost doubled.
Yeah.
So it's kind of coming back a little bit, right? So the recommendation for this is people need to get vaccinated, man. It's only 2 doses, and that's basically it. And after these 2 doses, breakthrough infections are so rare, it's less than 1%.
Wow.
And if you do get it, it's way less severe. And as we know from what happened in 2022, I mean, this is very painful. Okay.
Yeah.
This is very scarring. So, and it tends to be in areas that are associated with very sensitive tissue. So you definitely don't want to get monkeypox.
Certainly not on my sensitive tissue, that's for sure.
Yeah.
And so to be clear, if you had the double inoculation, chances are really low, like 1% of
They
having a
are.
breakthrough.
Yes, and I actually pulled up this. There's a really good like video about this on the CDC website that actually talks about, like how effective the vaccines are, and that
Does
they're
it
not
show any
recommended.
sensitive tissues?
All you got to do is Google monkeypox on Google and actually take a look
No,
at what
I
it
don't
looks
want to
like.
do it. I listened to you, Dr. Renzo Corzano. He is with Desert Oasis Healthcare. He's here to answer your questions at LGBTQ Health at mydohc.com. Ask a Gay Doc. Thanks for keeping us smart when it comes to what's going on around us in the community.
Yes, please get vaccinated for monkeypox.
Dr. Renzo Corzano can be found on Instagram. What is your handle?
At gaydoc.renz.
We appreciate you and everything you do in the neighborhood at Desert Oasis Healthcare. Have a good one, man. Talk to you.
All right, man. Bye.